So what exactly is cervical cancer, and do you think bleeding after sexual intercourse will be a sign of cervical cancer?
See, cervical cancer is the most common cancer in the worldwide and India also. In the world and India also. So it occurs from the lining of the uterus. Uterus is a female sexual internal organ where womb is there, babies are born. So terminal part of the uterus is called cervix. It's a normal thing. So the junction at the cervix, the junction of the cervix or layer of the cervix, epithelium is covered normally, squamous epithelium. If that gets transformed into the cancer, it is called cervical cancer. It is commonly seen in sexually active females. And as you asked, like bleeding after sexual intercourse is definitely a symptom of cervical cancer, but it is not always so. Sometimes it can be like cervicitis, there is an infection of the cervix can be, that time also it can be, bleeding can be seen. But since if the bleeding is occurs, the definite chance of cervical cancer is there, that needs to be worked up, and we need to do a pap smear examination and do the biopsy if required. Make sure that is not cervical cancer, because if cervical cancer detected very early, that can be treated surgically. But most of the time we see cervical cancer at a later stage, that is stage 3, which are usually treated with chemotherapy and radiotherapy together. Results are very good with chemoradiotherapy also. Earlier stages like stage 1 or stage 2B and all, we can do with radical hysterectomy surgery, that will give a good cure rate. So initially symptoms, if their immediate reporting to the clinician, will help in detecting the tumors early, and that will help give good results and the cure chance for the cervical cancer.